Amazing. Welcome, everyone. Let me just do a quick intro, Dr. Sims, and then we'll launch into some things. I just want to first begin by thanking Inside View Press for their sponsorship of the NATS chat. And tonight we are featuring Dr. Scott McCoy's voice, your book, Your Voice, and Inside View 3, and Basics of Voice Science and Pedagogy, which are most frequently used in recommended voice pedagogy books in current circulation. I know I used it when I taught the pedagogy courses, and as many of you know, it's a foundational component of my book. So it also includes a chapter on vocal health from Lucinda Halstead and a chapter from Lynn Helding on the brain. So I encourage you all to check this book out if you don't know it on voxped.com or Amazon. And thank you again, Inside View Press. Now we turn our attention to Dr. Sims. Tonight's topic is Mama used to say complementary medicine strategies can work. And Dr. Sims is the director of the Chicago Institute for Voice Care, a comprehensive voice treatment center dedicated to the care of voice and airways disorders. He is also an accomplished musician who plays trombone, bassoon, and piano. Dr. Sims, welcome. Thank you for being here.
Oh, thank you. And I apologize again to everyone, but I'm very glad to be here.
I hope the surgery was a grand success. That's most important.
Thank you. I think so.
Good, good. So tell me, I'd like to start with a little beyond the bio. And since you are a musician, I'd love for you to just take a moment and share with us a little bit about that background or how you continue to engage in music in your life now.
Yeah, I am a musician, born that way. I think most of us can sing before we can talk, and I certainly did. But I started the community aspect of it when I was probably 5 in a church choir.
Wow.
Um, just enjoyed singing, enjoyed hearing my voice with other people's voices. I didn't realize it or name it as such, but that was ear training, very early on as well. And I had a decent ear, so I could play piano, and I would hear stuff on the radio, and I would go and sit in piano and bang things out. And so finally, my parents were like, "Oh, we should get him lessons." And I was probably about 8 when I started formal lessons, and I'm a horrible pianist to this day because I wanted too much too soon, and I wouldn't listen. And God bless my piano teachers, both of them. I mean, they would assign stuff, and I was like, I don't want to play John Thompson. I don't want to play scales. I want to go to the music store and get Tchaikovsky, and I'm going to bring back some piece of music that I'm not ready to play yet, but I want you to teach me how to play it. And they were like, no, you need foundation, you need structure, you need rudiments. And I was like, no, I want to play this song. I want to play You Light Up My Life. Um, dating myself. But
I love that.
but I still kept the music bug. And so in 5th grade, public school band, I was like, oh, that trombone, that looks cool. That has a slide. It's a really cool instrument. And I ended up really loving it because that as well really trained my ear, slide position and hearing a note and tuning a note based on what the position was. And I think that whole uh, concept and enterprise just made me more acutely aware of how I heard things. And again, I loved how what I was playing fit in with what other people were playing. So I've always been a group person than a solo person. But I do solo work too. Uh, but anyway, it kept playing, and then when I was in 9th grade, I was bored, and I thought I want to do a woodwind, but I think I'll stay in bass clef. And I went to band director, and I was like, bassoon, yeah, that would be cool. Um, and it still is, like, just a fascinating instrument. Um, there was a time I made the reeds. I learned really to be a double reed player and go back and forth between that embouchure and the embouchure for the trombone. And but I was younger then, and I just loved it all. I don't play bassoon that much anymore. I still can, and I will pick it up from time to time, but I'm more consistent on the keyboard and on the trombone now. And I sing all the time because I just get on everyone's nerves with that.
I love that. Oh, that's delightful. I know you collaborate, of course, with a lot of voice teachers that are SVSs. Do you ever go and take a voice lesson yourself?
Yeah, years ago, I took lessons with Karen Wickland. I have taken
Oh.
lessons with Davin Youngs here. I have taken lessons with some of, and sometimes just like so I know what I'm referring people to, but also for
Right.
me because
Yeah.
I do want to try to always be learning. Um, I'm horribly unreliable as today is evidence of. So, yeah, so I don't do groups that much anymore because I'm always
Mhm.
late. Not on purpose, but
No, of course
just
not.
and
Mhm.
I end up overestimating everything or underestimating. And so I don't do that much group singing anymore, but I
Mhm.
still want to try
Mhm.
and be attentive to the instrument and take care of it.
Mhm. Oh, I
So
love
yeah,
that. That's great. Well, let's go to the topic at hand and discuss a general understanding of complementary medicine and voice care. So, what does complementary medicine encompass when it comes to voice care?
and some of this is just the terminology du jour. But I prefer, I think, complementary to alternative medicine, but
Okay.
conceptually we're talking about very similar things. But so I guess just go with me. um, some of this are just my thoughts as someone who majored in African American history, um, and so I'm a humanities person and a science person, and I
Mhm.
think that the concept of healing is very old, and we compartmentalize the ways in which people heal in communities. And I think we then end up creating this value system that I just don't like. And
Yeah.
so there are traditions that have been here for centuries, millennia even.
Yes.
And for me, like, I honor that. And so, and I understand that we have an idea that sets up Western medicine as the goal. And I mean, I obviously work in this industry and I learned it and
Mhm.
I appreciate it and I respect it. But I think that there are other traditions that are equally robust. And so I'm always open to, can I learn something from those other traditions that complements my knowledge, that allows me to take care of someone
Mhm.
differently, but effectively and knowledgeably.
Mhm.
So
Do you
that's how
feel
I,
a little do you feel a
sorry.
little bit alone in that? Because I collaborate with lots of docs, and I find I don't want to say resistance. I'm not going to put a label on it, but your openness to it seems unusual to me.
Well, I mean, I think that's part of why I titled this "Mama Used to Say" because I think there's a way in which many of us resist common sense, um, and and feel like it should be harder, or it can't be this easy. And so, I think many of us have things that perhaps not mom, perhaps it was dad, but someone in your family that you respected that didn't necessarily have medical training
Hmm.
was giving you information that was useful to you, and it seemed like that was too easy, and so you shunned it. And I
Hmm.
think that sometimes my colleagues um, shun some of the complementary aspects of medicine because we don't have a randomized controlled trial double blind study with a sufficiently powered N published in one of the major journals to prove it. But like I said, we've been doing it for millennia, and
Hmm.
there is a body of evidence that shows that these things work and aren't harmful. And for
Mm-hmm.
me, also just from a practical level, some patients don't want, some of the things that Western medicine has to offer, and they are
Right.
looking for,
That's right.
something else that's safe and effective, and at
Mm-hmm.
least having some knowledge of it. And I mean, I encourage everyone to do their own research and don't just pass out, candy, but be at least open to and aware of another paradigm that is
Mm-hmm.
or can be successful.
Mm-hmm. Mm-hmm. So it sounds like you found a way to balance traditional medical treatment and complementary strategies in your own practice. You actually do recommend outside of Western medicine treatment protocols, perhaps.
Absolutely. I'll recognize. I recognize and will recommend hypnosis, acupuncture, in inappropriate settings. And obviously, this is patient-centered care. So, if the patient doesn't strike me as the person who's going to really embrace that, I will just
Mm-hmm.
put it on the table very lightly. But if it's someone who I think they've already explored some of these healing traditions and are interested in it, then I will certainly share with them that I'm interested in it as well, and we can talk together about what's going to be a good management plan.
Mm-hmm. We have I'm going to go ahead and take this question. I haven't been able to read it, but somebody says, I have a new client that has been diagnosed with vocal cord dysfunction, and they are addressing both physical and psychological root. They cannot swallow pills or
No,
drink in
okay.
public. Uh, they cannot swallow pills. Oh, sorry.
I'm sorry, I was just talking real quick to my residents. Go ahead.
That's okay.
They've been diagnosed with vocal cord dysfunction and
Right.
can't pills in public.
They right or drink in public for fear of choking, and they feel paralyzed when they start choking. Our first session was phenomenal, and she felt that the breath work was successful. She's looking for more resources to help learn how she can help.
So this brings up another idea that perhaps I think differently than some of my colleagues, but um I refer to a book called The Body Keeps the Score.
Okay.
And the idea that the emotional pain that we carry often manifests physiologically. Um, and we actually published on this, but a lot of vocal cord dysfunction, and I'm not saying it's not a real diagnosis, it absolutely is, but I think that a lot of people don't think of it as a post traumatic stress response, and
Mm-hmm.
sometimes it is.
Mm-hmm.
Um, and I think that there are ways in which the SDS um, or SLP or anyone who's creating these meaningful, intimate relationships with their clients ends
Mm-hmm.
up doing some therapy that they may not be thinking that they're doing. And some of the breathing work actually helps people process trauma. Uh,
Mm-hmm.
so I think that sometimes we're treating PTSD and just don't name it that.
Mm-hmm.
Um, but I believe that incorporating a mental health person when you're treating BCD and some of these behaviors that ultimately have to do with a person who has been violated and feel like they need to protect themselves. Um, but getting to the root of
Mm-hmm.
that and processing it and understanding it, um, I think helps patients move forward differently.
Mm-hmm.
But that's definitely one thing I would think about in that particular setting. Um, Ways in which we can gently broach the subject of, you know, did something bad happen to you?
Mm-hmm.
Or are there some things that, maybe trigger these episodes that maybe you could talk about? Um, and I would at least, and I do this, with our patients, explore as gently as I can because you don't want to re-traumatize anyone, but at
Right.
least give them space to talk about it because I find not infrequently these are things that people have been carrying for years and love someone giving them room to
Mm-hmm.
talk and unpack it a little bit.
Hmm, that's wonderful. Well, and I think as voice teachers, singers really are willing to share with us, intimate details of what they've been through. And it's always so, we have to be so careful, though, scope of practice, right? And
Yeah,
knowing when to refer. And so I'm sure you must work with psychologists and therapists that you have on your file to refer to.
absolutely.
Yeah.
Because sometimes it is even approaching the neck to palpate it, or to begin even a little circumlaryngeal massage or any of those types of things that will help with the tension that we are perceiving and sometimes feeling. You can tell um,
Hmm.
the people who withdraw because you're approaching them that way. Um, and I will usually say, was there a time that someone made you uncomfortable with how they approach touching your neck or touching you? And that is sometimes just a peek into it. But a lot of times I get a ton of information about the trauma that someone
Okay.
has.
Hmm. I hadn't planned on mentioning this, but it occurs to me I've gotten into pain reprocessing therapy. Those
Yeah,
clients that I
yeah,
have biomechanically, the laryngologist has said we're looking good. The speech path has done their thing. I've been doing my thing, and they still talk about fatigue and pain. And
yeah.
in the last almost 2 years now, I've had quite a few clients that completely and very quickly have resolved ongoing voice problems with regards to fatigue and pain through pain reprocessing therapy that I'm collaborating with. And I brought it to PAVA last fall and had such a response from all the attendees. We did a whole panel on it, and that really awakened me to something.
Because again, the body is keeping the score, and it is carrying physiologic manifestations of
Hmm.
those unresolved conflicts.
Hmm.
And I think that the client knows on some level. I mean, I'm not saying like they know there's something wrong and they're like concealing it. I'm saying they know that like this isn't um, just fatigue. You know what I mean? Like they
Hmm.
know that like there's something about this that is out of proportion to like what's happening. Like it's more pain than they would ever have experienced before, or
Hmm.
those kinds of things. So I think they know that there's something a connection that's just not being made. Which,
Hmm.
again, while like when we can help bridge those things, the patients are just, and as you said, like fairly quickly they get a lot better, and it's very rewarding.
Hmm. Very interesting. It is very rewarding, especially these singers that have just had ongoing challenges around that, and they've been doing their work, they've been
Yeah.
compliant, and they're still dealing with this. And I'm thinking, what do we do? And then to realize it's basically neuropathic pain
Yes.
that is the culprit, and to have a solution through what's called PRT, pain reprocessing therapy. The book, The Way Out, was my way in. It was life altering as somebody who's a chronic pain sufferer. So that it was really eye opening to me to watch those clients become
ab-
healed through that. Yeah,
Absolutely.
it's really incredible. So I think one of my questions had to do with, do you recommend mindfulness practices for singers with MTD or phonotraumatic lesions or other diagnoses? I'm quite
Yeah.
certain you've already answered that for us. Yeah.
Absolutely.
Do you? So I'm not the most, I just can't meditate. It's just not my personality. But like the PRT has given me ways to be mindful, to help. Do you do mindfulness practice? And where do you
So
steer people?
yeah, I do, and a lot of it is breath work. I think that for that works better for me,
Okay.
because I can meditate on like a set of facts. I mean, that's basically what like do all day long. Um, and so I can focus and meditate in a certain space, but things like box breathing, or the H breathing, are just very helpful and calming for me. And again, maintaining just a sense of self, and focusing on what is my body doing in order to help me keep the oxygen that I need to survive? Um,
Mm-hmm.
and just being present um, as some of those phenomena that are wonderful, like how our bodies work, are happening, is really important, and helps with, anxiety and keeping me centered and more grounded. So I think I do more of the breath work than anything else.
Mm-hmm.
But like for me, it's the conversation with the person. If meditation works for you, we will lean into that. I just
Mm-hmm.
There are a lot of people who are like me who are like, yeah, that's not really my thing. But we can do some mindfulness techniques that
Right.
don't necessarily focus on just meditation.
Mm. I've always laughed that I'm like the target audience for mindfulness being able to, but we got to find our own way in.
Absolutely.
um, are there complementary strategies that particularly have a robust scientific backing for singers? I would say mindfulness actually does have quite a bit of science to back it, but
Oh, absolutely.
yeah,
I
what
think
else?
we're probably mindfulness, and again, just mind body connection. There's tons of science behind that.
Yeah.
So the big concept of it. I think in terms of like some of the things that I recommend to people that I do stress to them there's research behind this, um, have to do with ways in which we manipulate the glutathione pathway in the body, which is amino acid, a natural substance that we make that is anti-inflammatory, and reparative in the body. So we make it, but there are ways to stimulate making it. So um, one product that was, there's a good study done in singers is astaxanthin, which helps stimulate glutathione production. I have given IV glutathione to selected patients. I don't misrepresent anything, and I say that the studies for that are not 100% conclusive, but biochemically, there's definitely literature that shows glutathione is an important molecule in the human body, and having more of it can help with our oxidative stress response, the
Mm-hmm.
way in which cells repair themselves. So, like, there's bench research that confirms that. I think that what is a little less absolutely clear is that if you give someone an IV injection, it's going to head straight to the vocal folds and help them sing better. I don't know, and that's a difficult study to do. Um,
Yeah.
but that level of proof, I don't think exists.
Okay.
Um, I still don't think that this is, eye of Newt, wing of bat. It's not sorcery, but I, I am honest that I don't have the most conclusive study that is an effective way. But I do have patients for whom they felt a difference, were able to sing, felt like they had some of the benefit of even a steroid injection without some of the things that come along with that.
Absolutely.
But again, not everyone, and so for me, and this is how I think about many things. It's part of the conversation. It's something that I will put on the table, and we can talk about whether or not it's right for an individual patient.
Mm-hmm. What question should singers and voice teachers ask when evaluating alternative treatments? Like there was an interesting thread this week on NATS chat that
Yeah.
I pulled you into that you so kindly. I'd never heard of that. Something with silver.
Yes. So I mean, and that conversation, it, it actually did reveal like some of the ways in which, and I understand why people think, oh, this is woo woo, and why some people feel like I would never delve into complementary medicine because it's not a well regulated industry in certain ways. Um,
Mm-hmm.
because of that, and unfortunately, a lot of this just has to do with it's not fully monetized, and in our culture, things that aren't fully monetized, they don't necessarily feel like they need to regulate them because they're not going to make as much money from it.
Mm-hmm.
But that's mean that there's no science there, and it doesn't mean that all of this stuff is complete hogwash. But I do understand why it's hard to separate things out. But there are encyclopedias of alternative and complementary medicine. There's an organization in it. There's the naturopathy. American Association of Naturopaths, something like that.
Okay.
There are governing bodies and people who present peer-reviewed work. Um,
Mm-hmm.
it's just not as well promoted
Mm-hmm.
as some of our other journals, but there are certainly bodies of evidence that confirm, these types of things. And I do try to read and not really recommend anything that I can't find at least a few articles to,
Mm-hmm.
verify safety and efficacy.
Mm-hmm. We have a question from someone that they're 29, normal weight, non-smoker, low coffee, low alcohol. Started
Okay.
experiencing acid reflux past fall, was worried about it affecting their singing. They received an endoscopy and was diagnosed with hiatal hernia. Could this be stress related? They're now on acid reducer. Uh,
So yes, stress tends to a couple of things. The stress response, the hormones that are released in the body in response to that, tend to create more tension. Can increase our blood pressure, um, but also muscle tension in and of itself. Um,
mhm,
that contraction of the diaphragm can sometimes exacerbate the hiatal hernia. I mean, it's a physiologic thing, but again, the mind and the body are connected. So our stress state it can exacerbate a hiatal hernia that's there. Um, I'll take the opportunity to springboard into another sort of paradigm that I think does have good science behind it, which is alginate therapy.
Yeah,
And I'm bringing that up because we use that to treat reflux.
yeah.
And sodium alginate is derived from brown kelp and seaweed. And it's already used as a food thickener, so you can get food grade. Which is another one of the ways in which we can try to have some sort of consistency continuity about the products. Like if you get something that's food grade, the FDA does have a hand in proving that, um,
Mm-hmm.
or some level of standard about this is safe to ingest. And so I digress, but the food grade sodium alginate can be used to make a little plug that functionally doesn't allow things to come back up the swallowing tube. And
Mm-hmm.
so um, it can be successful for someone with a hiatal hernia.
Mm-hmm. Speaking of reflux, of course, and alginates, the Reflux Gourmet,
Yeah.
Gaviscon Max, Gaviscon Advanced are those the ones you recommend as well?
So, I've expanded now. So Reflux Gourmet, Reflux Raft.
Oh, I
Um,
don't know that one.
that's a very similar product to Reflux Gourmet.
Okay.
And I'm on nobody's payroll, so I can talk about all of them. And I've taken all of them. So,
Mm-hmm.
either the products, they have different flavors. And, that's a complete matter of taste and one's individual palate. But they have all worked for me. I guess I would say the Gaviscon Max Relief is probably the least pleasant, just because it's that sort of chalky and bubbly
Yeah.
chewable tablet that I'm like, this is one of the weirdest consistencies of anything I've ever ingested. But it does work.
Yeah. The Reflux Gourmet is actually pleasurable.
Um,
Yeah.
so they have like the vanilla caramel and the mint
Yep.
chocolate.
Yep.
Personally, I prefer the mint chocolate. The vanilla caramel a
Oh,
little sweet for me. For me, I have patients who love it. Reflux Raft has mixed berry and lemon ginger. Um, both completely fine.
okay. Well, that's always such a hot topic. I never thought I'd spend so much of my career talking about reflux, but it's huge.
It is, and I think for me, it's like everything else. Like I think I don't want to miss it. I don't want to ignore it. I also don't want to overdiagnose it. And I think that one of the things we will probably be publishing on in the next couple of years is there are really different phenotypes or expressions of this, and we shouldn't confuse them. In
Mm,
that, some people who have episodes of reflux that are fairly severe and they have them every day, that person probably is a decent candidate for a proton pump inhibitor or possibly even surgical therapy for it because of the severity and consistency and frequency of the symptoms. There are
mm,
other people who will have an episode of reflux, particularly if they eat something that's on the no-no list, but
right,
they won't have that will heal and they won't have another episode of reflux for 4 or 5, 6 months.
right.
That person, I think, is better off with alginate therapy or something that can be taken, on a more as needed basis. I don't think
Mm,
that person necessarily needs to take um, an antacid every day. And then there are nuances of, is it the acid or is it the digestive enzymes that get activated by the acid? And I
mm,
think we will know a bit more about that in the
mm.
coming years as well.
Do you recommend people come off the PPIs after 3 months, 6 months? There used to be where people would get parked on PPIs for a year. And for people that don't know, the proton pump inhibitors like omeprazole, Prilosec, Prevacid is what we're talking about. So they'll
Yes.
get parked on them. So how do you wean people off, and do you wean people off?
Absolutely. So, like, if I start someone on it, I usually say, well, this is what we're going to do. And I lay it out. We're going to take it for a month every day. If you don't feel any different, we're going to reevaluate. If you feel like you got better, we're going to push that to 3 months to try to get everything healed. And then we're going to start trying to taper you off. So,
Mm-hmm.
I try to, on the front end, say, this is not a medicine I want you to take forever.
Right.
There, I think there's a specific problem. We want to provide a specific appropriate remedy, and then we want to reevaluate. Um, I usually then go from every day to every other day, and reduce dosing so that we don't get rebound. I think it helps
Mm-hmm.
reduce rebound to not just stop cold turkey. But yeah, for me, I, I like the proton pump inhibitors. I use them, but I don't think that they should necessarily be the mainstay for everyone. And I definitely don't think we should just put people on autopilot with them.
Mm-hmm.
Now,
Mm-hmm.
there are some people who, when we try to take them off, they have severe and frequent enough symptoms that they do need to be on a proton pump inhibitor.
Mm-hmm.
I think that number is much smaller than
Mm-hmm.
we thought.
And that's a candidate, then you would refer to a gastroenterologist to consider surgery or something, if
To
or
consider
not
surgery,
necessary.
to make sure they don't have some of the long term um,
Mm-hmm.
effects of
Mm-hmm.
chronic reflux, things
Mm,
like Barrett's esophagus that can be a precancerous condition. But
right.
that select group of people who don't really respond well to conventional therapy, I do think we maybe involve other people, and we certainly follow them a little bit differently. um, I just think that group is smaller than we originally kind of made it.
Mm-hmm. Turning to a different couple other topics here. Dry mouth syndrome, which singers have sometimes from medications or maybe separate from medications. Do you have a recommendation for that?
Um, it depends with everything. So some patients, I recommend, just making sure they drink more water, using things like a saline nebulizer just so that they breathe in moist nebulized air, and help. I have
Mm-hmm.
patients that I use xylitol,
Mm-hmm.
um, the just really, or any sugar-free candy, honestly, just sucking
Oh,
on
okay.
can just help, create more moisture there.
Mm-hmm.
Occasionally, I will have patients do something like dried papaya or dried pineapple, but
Hmm.
not a lot because that is very sugary and that can quickly, rapidly turn into some dental issues.
Ah.
But the papain in the papaya and the bromelain in the pineapple actually does help with creating, a bit more thin mucus and stimulating mucus production. So
Mm-hmm.
sometimes I'll have people do that, maybe once a week or something like that, as a part of a greater regimen.
Mm-hmm. What so just overall then some herbal supplements or other things that singers you think would be on our top list of 5 things we might have in our voice kit to have on hand. Are
I think
there? Yeah, yeah.
throat coat and throat shield tea, either of those, I'm usually fine with. Um, I often take um, shaga mushroom. I make my own little elixir of that. So this is a mushroom that grows kind of on the bark of birch trees, and you kind of have to chip it off. But you can get it online in these dried chunks. Excuse me. I take those, and in truth, I make an elixir. So I put some like grain alcohol on it, and a stick of cinnamon in it, and I make that, and I put a dropper full under the tongue, actually most days. And this is an immunostimulant that stimulates something called natural killer cells in the body, so it's an immune booster. And
Okay.
I find that helps me um, ward off colds and viruses.
Hmm.
I think another of one of my go-tos is oregano oil, 100% oregano oil. 1 or 2 drops of that as part of a saltwater gargle can help a ton of sore throats.
Oh gosh, I've not heard that. Okay. Saltwater gargle. And what about elderberry? Somebody's asked about that. Is that something you?
I think that is in general a good immunostimulant, and I like it. In the early phases of COVID, we weren't completely sure whether or not that helped trigger the cascade that led to the hyper response of the immune system that led to the adult respiratory distress syndrome. But I think we're back to believing that it may be a part of that cascade, but it's not a major trigger, and so it's
Mm-hmm.
still safe.
Wow. Well, you have been so generous. Are any kind of final thoughts for voice teachers as we help with singers deal with a variety of challenges with health?
I mean,
Any
I think,
final thoughts?
yeah, be open. I think that again, healing traditions come in so many forms, and none of us can know everything. And I think, again, back to my answer to that question earlier, I think sometimes the tendency is if I don't know it or I didn't study it, um, I completely dismiss it. And I
Mm-hmm.
understand that, again, we can't know everything and we can't have studied everything, but being open to what clients tell you they're using. Now, I do think we always need to have conversations and, a la that um, discussion. Silver does have some immune stimulating properties, but you need to get colloidal silver, a specific type that is formulated a specific way to be absorbed by the body and not discolor the skin and not develop. It's a mineral, so in high concentrations, it can be toxic. So I do think people have to read labels and be clear on the differences between these substances. Um, but I do see some medicinal uses for these things. Now, again, from that particular discussion, I'm very, very careful about inhalational use of anything because the lungs can be very fragile. And this is true, I've talked about this for years. Like anything that you inhale can injure and will definitely affect your vocal folds.
Mm-hmm.
Um,
Mm-hmm.
and so I say, if you clean with bleach and ammonia, breathing that in is actually pretty harmful. Those agents really are very irritative to the vocal folds, and breathing that in, your lungs don't really like that. And then, of course, hookahs, e-cigarettes, any of the litany of things that people can inhale recreationally, that's just not a good way to do it. Uh,
Mm-hmm.
the structure of the lungs, the parts of our immune system that are in the lungs, they don't really like being challenged by some of the things that we inhale. And so
Mhm.
I have a lot of patients that I'm like, you need to just switch to gummies or edibles, like some other way. If you just need that feeling, I'm not judging you, I'm not knocking it, but inhaling it, like if that is your route of administration, that can usually cause problems. And so
Mhm.
uh, I try to stick to mostly saline. Occasionally, I have patients that I will add medication to for very specific reasons, for things that they can inhale. But even that, I tend to use the eye drop, which is incredibly mild, um, and that preparation before I have people inhale it.
Mhm. Gosh, what a wealth of information. I cannot thank you enough. And that was just the complementary medicine, nothing even with your Western medicine deep knowledge. So we'll have to have you on again. I'm so grateful to you for your time and for coming right from surgery to this. Thank you so much, Dr. Sims.
Oh, my apologies for that. And I am happy. And if people, I don't know if there are any other questions, but I'm happy to give you time because you waited for me, and I appreciate it.
Oh, that's so sweet. I do see just one quick question about anything big for asthma and one about ginger.
I love ginger. Asthma. I think, well, I will say one way in which we help with asthma is treating underlying allergy, because the a lot of the manifestations of allergy are a continuum of sorry, a lot of the manifestations of asthma are a continuum of the allergic response, the sort of exaggerated or hyperactive response of our immune system to things that we inhale or that we encounter that trigger it. So, with asthma, it can be cats, it can be trees, it can be grass, those types of things. And so, one of the things that I think helps is immunotherapy,
Mm,
whether it's the weekly shots or the other method of preparation where you put the drops under the tongue, um,
mm-hmm,
to teach the immune system not to be so hyperactive. I think patients with asthma do better when we control some of the allergic response.
mm-hmm. Okay, interesting. Well, thank you, everyone. I can't thank you for your generosity tonight. I see that everyone stayed on, so thank you for going over time with us. And I want to just remind everyone that April 13th is our next NATS chat with May Oskin, and we're going to talk about vocal distortions, making some of those rough noise sounds. So, we're going to have a singer on with her, so we're going to actually make some sounds. They are. I'm not. Please join us. Maybe Dr. Sims would like to be one of our singers.
You never
make,
know.
make some sounds with us. So anyway, everyone be well and take care. And thank you so much for joining us tonight. Good night.